Hello everyone. Last class we discussed about nervous system. What are the disease involved in the nervous system, like Alzheimer's disease and Parkinson disease. In this video, we will see the epilepsy disease. Epilepsy is the chronic and neurological disorder characterized by recurrent and unprovoked seizures, which are caused by the sudden and abnormal electrical activity in the brain. It means it is the chronic stage neurological disorder characterized by recurrent and unprovoked seizures which are caused by sudden abnormal electrical activity in the brain. It means abnormal electrical activity in the brain. Okay, in the brain, in the human body, we have the lot of electrical activity in the brain. That electrical activity, abnormal electrical activity in the brain, that is called epilepsy. Next, a diagnosis of epilepsy typically requires a person to have at least two unprovoked seizures that more than 24 hours apart. That one unprovoked seizure can still indicate the condition if there is high risk of recurrence. Okay, that means the persons have at least two unprovoked seizures that are more than 24 hours apart. Though one unprovoked seizure can still indicate the condition, that is called diagnosis of epilepsy. Next, what are the symptoms involved in the epilepsy disease? Means staring into space or having a blank look and temporarily confusion and slowed thinking and trouble speaking. Next one is uncontrolled jerking or twitching movements often in the arms and legs. Next one is stiffening of the body. Next, loss of consciousness. Next is loss of bowel or bladder control. Next is sudden falling or no apparent reasons. Next is sudden rapid eye blinking. Psych symptoms feel like a fear and dead like thing. Next, what are the causes? Means brain injury, genetic factors, brain condition, infections, and also unknown. Brain injury means traumatic brain injuries from the accidental or falls. Next, genetic factors. Genetic factors means some type of epilepsy can be inherited. It is the inherited disease. Next, brain conditions, strokes, brain tumors, and other neurological disease like Alzheimer's can trigger seizures. Next one is infection. Infections such as meningitis or encephalitis can lead to the epilepsy. In fact, all of you know about meningitis, inflammation of the brain due to the any infection. Next, unknown. Unknown is for many people the causes of epilepsy is never identified. That is unknown. What are the treatment involved in the medication? Means anti-seizure drugs are common form of treatment. Next, surgery. In some cases surgery may be option to remove the part of the brain causing seizures. Next one is diet, and some individual may find relief with this specific diet such as a ketogenic diet. Next, vagus nerve stimulation. The device can be implanted in the stimulate the vagus nerve to reduce the seizure. There are the four treatment. What are the four treatment? Means first one is medication, surgery, diet, and vagus nerve stimulation. Medication means it is used by the anti-seizure drugs like phenytoin and carbamazepine. That is the used by the epilepsy drugs. Next, surgery means what are the surgery involved in the to remove the part of the brain causing seizure. Next one is diet. Some individual may be find the relief with specific diets such as ketogenic diet. Next, vagus nerve stimulation. The device can be implanted in the brain to stimulate the vagus nerve to reduce the seizure. That is called vagus nerve stimulation. Next, what are the types involved in the epilepsy? Means there are four types: focal epilepsy, generalized epilepsy, and combined generalized and focal epilepsy. Last one is unknown onset epilepsy. First, focal epilepsy means seizure originate in one specific area of the brain. Seizure originate in one specific area of the brain, like the temporal and frontal lobe. Temporal and frontal lobe are present in our brain. Okay. Next one, generalized epilepsy. Seizure affect both the left and right side of the brain. Affect both the right and left side of the brain from the beginning. That is called generalized epilepsy. Third one means combined generalized and focal epilepsy. Means individual with the type experience both focal and generalized seizure. That is called combined generalized and focal epilepsy. Last one is unknown onset epilepsy. The diagnosis is made of but physicians are unsure if the seizure are focal or generalized. That is called unknown onset epilepsy. What are the types seizures? What are the types of seizure? Means tonic seizure, clonic seizure, clonic seizure, atonic seizure, myoclonic seizure, absent seizure. Tonic seizure means cause muscle stiffness and can lead to the falls. Next one is clonic seizure involving the rhythmic and jerking muscle movements. Next, tonic clonic seizure, a combined of both and tonic suffering and clonic jerking. This type of was formerly by known as grand mal. That is known as grand mal. Next one is atonic seizure. It result in the sudden loss of muscle control leading to falls and also called drop attacks. Next one is myoclonic seizure. Myoclonic seizure is a sudden Next, myoclonic seizure characterized by quick and shock like jerks or twitches of the muscles or group of the muscles, that is called myoclonic seizure. Last one is absent seizure, previously called, that is called petit mal. Tonic-clonic seizure other name is grand mal. Absent seizure is also known as petit mal. This typically involves the brief lapse in unconsciousness, often accompanied with staring and subtle body movements. Tonic seizure means there are 6 types of seizures involved in the epilepsy. Tonic seizure means cause muscle stiffness can lead to the falls, that is called tonic seizures. It affects muscle stiffness that can lead to the falls. Next, clonic seizure means involve the rhythmic and jerking muscle movements, that is called clonic seizure. Tonic-clonic seizure means also known as grand mal. It is combination of both and suffering and clonic jerking. This type of known as grand mal. As atonic seizure, this is a reason sudden loss of muscle control leading to falls and also called drop attacks. Myoclonic seizure, it is a chronic, it is a characterized by quick and shock like jerks and twitches of the muscles or group of muscles. Next, the absent seizure, previously called petit mal. It is typically brief lapse and consciousness upon staring and subtle body movement, that is called absent seizure. Okay. What is difference between seizure and epilepsy means? Seizure is a single temporary event caused by sudden surge of electrical activity in the brain, while apart from seizure, epilepsy is the chronic brain disorder characterized by the recurrent and unprovoked seizure. Seizure means it is a single and temporary event caused by the sudden surge of electrical activity in the brain, while epilepsy is a chronic brain disorder characterized by recurrent and unprovoked seizure. Think of the seizure as the symptoms or epilepsy of the diagnosis that requires 2 or more seizures with no clear trigger such as illness or injury. What is definition of seizure means? A single and temporary event caused by the abnormal activity of the brain. Epilepsy means a chronic neurological disorder marked by 2 or more unprovoked seizures. What are the causes of seizure means? Can have many causes including fever, head injury, stroke, reaction to medication, can occur just once in a person's lifetime. It is the person's lifetime seizure. Next, epilepsy causes means caused by the brain predisposition to the have recurrent seizure, that the specific cause can be genetic but is often unknown. What are the frequency of seizure means? Single event. Epilepsy means multiple events over time. Next, treatment of seizure means the underlying cause is treated. If there is a clear removable cause, it may lead be the only treatment needed. What are the treatment of epilepsy means? Requires ongoing management often with anti-seizure medication and in some cases are surgery. It involved in the surgery. Okay, it is the involved in the surgery. Next, what are the symptoms? What are the 5 symptoms of epilepsy means? Your body became stiff or floppy. Next, suddenly falling to the floor or jerking or twitching movements in your body. Next, peeing unintentionally. Next, losing awareness of the what's around you. You may be staring into space and not able to the response normally. And what is the difference between epilepsy or seizure? Epilepsy is the single event. Seizure is the single event. Epilepsy means multiple event. The overall view of the seizure means the seizure evolution, emergency room, and primary care provided. Diagnosis could be epilepsy, not likely epilepsy. First seizure, and there are involved first seizure and second seizure. First seizure for low risk for second seizure, then one is high risk for second seizure. Next, epilepsy in continue the seizure may be continuous in the epilepsy. It is a begin treatment anti-seizure medication. Given the anti-seizure medication, already we told phenytoin, carbamazepine, valproate, sodium valproate. This is the anti-seizure medication. Low risk for second seizure means review individual risk and benefit or positive and negative treatment. That is called seizure and epilepsy. What are the other medical causes means? Physiological cause and other medical cause. Other medical cause means non-seizure, signal, migraine, sleep disorder, movement disorder, provoked seizure and acute illness, fever, vascular trauma, and toxic metabolic. Psychological cause means psychologically non-epileptic seizure, that is called PNES, psychological non-epileptic seizure. It's treated with psychotherapy. Involved in the psychotherapy, that is called psychological causes. Other medical causes means involved in the anti-seizure medication, that is the medical cause. These are the difference between seizure and epilepsy. Next video we discuss about other disease involved in the nervous system. We discuss about Alzheimer's disease, Parkinson's disease, seizure and epilepsy. Next video we will discuss about schizophrenia. Next one is depression. It also involved in the nervous system. Thank you.